Earlier this year, the Gauteng Department of Health terminated its contract with Life Esidimeni, a hospital in line with the Mental Health Care Act, resulting to about 1,385 relocated to different NGOs around Gauteng. It's been reported that 36 psychiatric patients have died from some of the NGO mental health centres contracted by the Gauteng Department of Health. Well, in studio to give us an update, we are joined by the MEC herself of Health here in Gauteng, Qedani Mahlangu. MEC, thank you for joining us. Welcome to the programme.
Thank you, Leanne, and good morning to the Morning Live viewers.
Well, you saw, I imagine, the interview. You were listening to the interview previously, yes. And you heard from the relative of one of the victims that has passed away. I mean, what is your response to this? She says she hasn't been contacted by the health department. She didn't know. She was contacted by SMS on the day. It sounds like the procedure was really not fair.
I don't think it's going to be correct for me to speak here about Christine's engagement with the department and isolate her. But just to put it on fact that the president of the Psychiatric Association makes the point that they tried to engage with the department, the procedures were not followed. As a matter of fact, we can meet with the chairperson of the mental health review tomorrow, Mrs. Dumisama Masondo. She's been part of the processes from day one of interviewing and working with families. But most importantly, we've got the mental health teams that are all over the department in the 5 districts, Johannesburg, Ekurhuleni, Tshwane, as well as Sidibeng, and the provincial department that oversees all our health mental services work. But also in some of the meeting, I was present myself. In Waverley, we met with about 500-600 relatives in one room, and we agreed in that meeting in my presence, and I gave everybody my mobile number. But if they have a problem, they can talk to me. In that meeting, we agreed to establish a committee from the parents, because we couldn't work with all 800 of them at one go, to establish a committee which was going to work with the officials of the department. And I said emphatically to all the families in that meeting, if you go to view these places which have been identified by officials and you are not satisfied, please call me. We need to change and go to places which we are going to approve. I did not receive any one of those calls. Instead, we had marches and marches. People were complaining about the contract instead of dealing with the issues that we had said to the families. The HOD, who's the head of department, together with our teams again, went to Randfontein in the center where I was not. And Christine was in that meeting when the HOD was present in all of those things. And that meeting was difficult. And Christine was one of those people who were present in that meeting and all of that. And the rest, I think, let's leave it there. We'll continue to offer our support to each and every one of the families who are willing for the department to give support. We'll continue to give them a guidance, and of course, where we're wrong, we'll admit where we're wrong. But I think in this instance, particularly in the instance you're referring to, even Dr. Manamela called Christine not so long ago, and she said to them, stay with your condolences with yourself. So I don't think it's important for us to be going back and forth about individual cases. Let's stick to the principles, and we'll continue to say, even with Christine's family and many others, we say our deepest condolences. We do not like to see anyone dying in any of our institutions or in any of the partners that we're working with. That is why we've approached the minister yesterday. I had a meeting with the minister, with the team. We said to the minister, can you assist us? We've done the work, but we think that we need to get someone independent to give us an independent view of the work that we have done, because this matter is serious. The minister agreed. He appointed the ombudsperson, who's then we are going to hand over the documents to him today, and let's wait for the report to be completed by him. And we're willing for him to look at the entire process when we move the patients up until the end, because that is important.
Well, let's talk about the process, because I mean, there's a lot of allegations and there's a lot of things being said, but the fact that these patients, and we're referring to about 1,400 patients being transferred without any clinical documents. I mean, some being taken to institutions where I mean, it is physically impossible to be able to do something like this. They don't know what medication they're on. They don't know what their cases are all about. I mean, these are not proper practices by the health department.
I think let's clarify that when the point I want to continue to make, which I've made the whole day yesterday, many of the patients, if not all, walked out of life with one set of clothes. And that I got from the NGOs who received the patients. And some of the people walked out with one shoe instead of having a pair of shoes. Having said that, what we also did, each and every patient came at least, we ensured that happened, came at least with 1 month supply of medication when they walked into these NGOs. That's why the care workers who are in these NGOs, some of them were working for Life, are not new care workers. They were looking after these patients at Life, and they've continued to go with them wherever these patients have been. Whether you go to Cullinan, whatever, I do not know exactly geographically where they are, but I do know that the care workers were working at Life, and from the care workers up until the enrolled nurses and the assistant nurses, all of them moved to facilities, with the exception of about 4 or 5 of those nurses who currently have not been absorbed and working on a process of taking those. So the care has continued with those nurses were looking after them. When they got to the facilities where they were, and I've visited some of those NGOs, some of them have been doing this work for more than 10 years. They've been looking more or less after the same type of ailments of patients we've sent to those institutions. Men are together with men, females are together with females. Of course, where there was a mistake, I think there's one NGOs where there was a mixture of gender that we've also corrected, because we've said to ourselves, Leanne, this matter is very complex. Once we've settled the NGO patients in the NGOs, we've said to ourselves, our medical teams in Tshwane, we've got Dr. Funeka Sogutela, who's working at Vescopis, one of our psychiatric institutions, who's leading a team which is overseeing the work of the NGOs, including having medical medical treatment and ensuring that those NGOs are visited on a weekly basis. Even last night I was reading a report, and those over that team.
I do understand all of this. We're dealing with 36 dead people. So something's gone wrong. I mean, you're making it sound like it was a smooth process and you did the best you could. The reality is you didn't do the best you could. 36 bodies, 36 families have lost.
That is why, and we want, we've asked the minister for support so that they can investigate and get to the bottom of this matter.
Who's going to take responsibility for this?
Once the report is finalized and it points out the responsibilities to us, whatever, we'll take responsibility. That's why I've not run away from this matter. At every step of the way where we needed to account, where we needed to explain our action, where we needed to take responsibility, I've always been there, and I'll continue to do that till the last moment. If the ombudsperson come up with whatever report, which the Premier is going to see, the Minister is going to see, we'll take those decisions on the basis of that. But for now, let's allow the ombudsperson to do their work, and once they've completed their work, we'll deal with this matter. Yes, the matter is serious, and that is why we said we cannot investigate ourselves and then say everything is fine. We must subject ourselves to public scrutiny, to the ombudsperson who is established, who's independent, who's not working in the Gauteng environment, who's going to help us to give an objective view. That's why how we take this matter seriously.
MEC, we have to leave it there for this morning. Thank you very much for joining us on the program. The MEC for Health here in Gauteng, Qedani Mahlangu, thank you again.
Thank you very much.
All right, let's take a break. News after this. Stay tuned.